I am Alyssa DeFilippo. I'm the manager of Connections California at Parents Helping Parents. And that is a free online information and resource hub for transition to adulthood and adult services for people and parents and families of who have loved ones with all kinds of disabilities. And as I said, you are at creating a successful Social Security disability application. It's the first in a series of 4 public benefits sessions that we will have this September. They are on Thursday evenings at 6:30. The second one on the 14th is a shift from SSI to SSA's Disabled Adult Child program. That's always a popular one. How to avoid the most common SSI application pitfalls is on the 21st. And Medi-Cal eligibility categories for people with disabilities is on the 28th. And I will put links to registrations in the chat, so you'll be able to sign up for them now if you'd like. I would like now to introduce our illustrious presenter of the evening, Daniel Fortuño. He's the president and CEO of Benefits Education Center and has 30 years experience, over 30 years experience in training, counseling, and education in healthcare and benefits administration. As a national expert on disability benefits, he is highly skilled in interpreting public and private health and welfare benefits programs. He has worked in 11 states across the country and has trained and counseled over 20,000 individuals and providers during his career. And he's a darn good teacher, if I must say so myself. So I thank you again for being here. And please remember that no donation is too small. It allows us to keep going and bringing free presentations like this one to you. So thank you very much. I'm going to turn it over to you, Daniel.
Thank you. Give me just a moment. And give me a second here. Sorry. I think we have Winner. Are we there? We are there. Okay. Daniel Fortuño with Benefits Education Center. I always let people know whenever I get into any of my trainings that I've done over the years, that benefits are very much like a dysfunctional family. They do not make any common sense. And just like my road sign, the road looks straight, but it's going to have a lot of curves in it. And that's just the way it is. If you understand that up front, and you understand that nobody is trying to deny you anything, they're just operating in a system that's bound by rules. And that's what we're going to be going over with today. I can get my screen. Here we go. Okay, so the first thing I'd like to do is to go over some of the acronyms. SSA stands for Social Security Administration. If you say SSA benefit, you are not saying what the benefit is. You're saying Social Security Administration benefit. And be aware that written information, oftentimes, especially from Social Security, they attempt to simplify the program, and oftentimes their explanations can be confusing. This is why it's imperative that you know the acronyms and which program you're talking about. SSDI stands for Social Security Disability Insurance. SSI stands for Supplemental Security Income. SSI does not stand for Social Security. It stands for Supplemental Security Income. So these are some of the main acronyms that we're going to be using this evening. Another is SGA. And that stands for Substantial Gainful Activity. And that's a term of art that's used in many places in Social Security. And it happens to actually be a dollar amount that changes every year. And for this year, it's $1,470. And if an individual meets Social Security's definition of being blind, it's $2,460. You don't have to memorize this issue right now. It's just so that you understand what SGA stands for. And when I bring it up, I will also, again, bring up the dollar amount. And mind you, the amount changes each calendar year. Now, How does Social Security define disability? And the definition is the same for SSDI as it is for SSI. They define disability that an individual is unable to engage in any, here's that term, substantial gainful activity due to medically determinable physical or mental impairments. And it could be a single or multiple impairments. The result of that impairment has lasted or is expected to last 12 months or is expected to result in death. Social Security considers the inability to perform any kind of work. So they're taking into account the age of the individual, the education, and the work experience when they're looking at that individual's disability. Now, Social Security, so that they apply the rules evenly, they have what's called a sequential evaluation process. And that sequential evaluation process is how they review each disability to determine if somebody meets the criteria. And it is not true that the first time you apply, you get denied. That just happens to happen in most cases based on Social Security's website. But if you have all the pieces and parts together and present the case in a way that is clear to Social Security, you can get granted, within a reasonable amount of time, which with as backed up as they are is about 3 to 6 months now. Used to be 2 to 4 months. So the first thing is they're going to be looking at, is the individual working? If that individual is working and they're engaging in SGA, they're not disabled. So Stephen Hawkins is somebody that we know had a significant disability, but my understanding is that he earned SGA. Therefore, as disabled as he was, according to Social Security, he was not. They're also going to say next, is the disability severe? So they want to understand the severity of the disability. At no point, or at this point, I've not brought up diagnosis. Come on, here we go. The next thing they do is they evaluate, does this individual have what's called the listing level of impairment? Because if a person has a listing level of impairment, they're not working, or they're below SGA, they have a severe impairment, and they meet Social Security's listing level of impairment, they have what's considered to be as an automatic qualifier, my word, and they are granted at step 3. So let's take a look at what that actually looks like. Social Security maintains the listing level of impairment in what they call the blue book. There's also a red book. So the blue book is the actual list of the medical conditions that if you meet the criteria, you automatically qualify if you've met step 1 and 2 in the sequential evaluation process. Whoops, I hit the wrong button. Hold on. Jiminy Crickets, I apologize. I clicked on the link by mistake. And sorry, how do I get my screen back? Jiminy Crickets.
You might need to exit and then come back in again.
Okay, sorry about that, all.
We can just talk amongst ourselves.
Yeah, if you could, please. Because I show that I'm in.
There we go.
There we go.
Well done.
Sorry about that. I'm good at teaching, and my Zooming is on a scale of 1 to 10. about a 3.5. Okay, here we go. Now, so the blue book, and I need to get rid of this little box here. Is it showing on your screen or are you getting the full screen, please?
Full screen, Daniel.
Okay, thank you so much. Okay, so the listing level of impairment, I apologize, I am back. And here is when you go in, you look at it, and they have a section that's listed for adults and a section that's listed for children. Our focus today or this evening is on individuals over the age of 18 prior to their normal retirement age. So we go into adult, and it actually goes into body systems. So as an example, I'm going to go into mental disorders adults. And since the bulk of my practice seems to be individuals with autism spectrum disorder, this is Social Security's listing level of impairment. Social Security's listing level of impairment for an individual with autism is not a diagnosis alone. It's the diagnosis, and then just like a recipe, it says a medical documentation of both of the following: qualitative deficits in verbal communication, nonverbal communication, and social interaction, and significant restricted repetitive patterns of behavior, interests, or activities, and see, it's like a recipe. Extreme limitation of one or marked limitations of two of the following, and understanding, remembering, interacting with others. So it's very clear what they're looking for. What they're trying to do is based on the medical record, not a doctor's statement of disability, is capture at the listing level of impairment. Step 3, if the individual meets this criteria, they're on the program, they're granted. So we've gone through step 1, 2, 3, and if an individual does not meet step number 3, then they're going to take them on to step number 4 and review, is the individual have the capacity for past relevant work? And relevant work is within the last 15 years, or up to 15 years is better said. And then if the individual does not have capacity for past relevant work, then they're going to evaluate based on their age and education. Is there any job, not where they live, but in the US economy, that they can do? Now, what I tell people, it's really important that the medical record tell the story of the individual. I was very clear with the listing level of impairment on how the condition, that particular, the way they described autism, the way that it needs to present. And this is where people often have issues. If you're going to be capturing the limitations of an individual, you really need to make sure that whatever the symptoms are being documented in the medical record articulate the frequency, the duration, and the severity. If you follow this simple principle and making sure that a medical record captures the frequency, duration, and severity, it will capture what's going on with that individual's disability, so that if they have a condition that's in the listing level of impairment, then they can qualify at step number 3. Now, the application process is as follows. Social Security, you do the application with the local office. They allow them to be done online now, both for SSI and SSDI. Then once a local office has done their process, which basically they do non-medical, so they're evaluating whether it's SSI, SSDI, if it's both. And then once they've determined what program the individual's application is appropriate for, then they send it off to Disability Determination Services, DDS. And DDS are the individuals actually that work for the state of California, even though it's a Social Security program. There are DDSs in every state. that work for Social Security, the federal program, and they have medical and non-medical evaluators that work in tandem. Non-medical being the individual that collects the records, gets what's needed, and then they provide it to the medical evaluator who reviews the records to evaluate the severity of the disability. When you do the initial application, the appeal process is as follows. You have, if you're denied, what's called a reconsideration. If that's denied, then you go to the hearing with an administrative judge. The initial application, they're taking about 6 months now. The reconsiderations are taking a bit longer because they're backed up. Those can be done without an attorney. An attorney is highly recommended when you're at the hearing level. And to get to a hearing, it takes anywhere from 1 to 3 years. If the case is put together really well, sometimes when the case is assigned to an attorney and all the records are there, they'll actually review them to see if they can make what's called an on-the-record decision, even before it goes in front of a judge, if the evidence is there that's needed. If you get denied, you can do the appeals council review. And then finally, district court case. I'm not aware of cases personally that have gone to the appeals council review and district court cases, but those are the options that are available. Again, the first time you apply, you do not have to get denied. It just happens in most cases. So let's talk about the 2 Social Security programs that I've mentioned. Now I'm going to go into the programs now in a bit of detail so that you have understanding of what the programs are. I've given you the definition of disability, and that's kind of like the doorway in. And now we're interacting with, I nicknamed them the twins because they look alike, they sound alike, they have the same definition of disability, but they're 2 completely different programs, and individuals may qualify for one or the other or both, depending upon their situation. So let's first go into SSDI, Social Security Disability Insurance. This is a program, it's an insurance program that's based on contributions. And the ways that people can qualify is in an individual's work record, based on their work history, or a disabled adult child, also known as a childhood disabled beneficiary. They changed the name, but nobody seems to use it. And a widow or widower. So those are the ways individuals can qualify for Social Security disability insurance. Now, for somebody who's wanting to qualify based on their record, they actually, from age 18 to 24, require that you have 6 credits. What's a credit? Well, basically, Social Security doesn't, they always, in my experience, create a new word to describe a principle that often is understood. And a credit is basically, in a calendar year, there are 4 credits, which is known as 4 quarters. So it's basically 1.5 years of work within the previous 3 years. Whoops, sorry, I went too fast. Let's go back. Sorry about that. I already warned you. I'm good at teaching, but with the occasionally I have challenges. Oh, I went too fast again. So basically, depending upon the age of the individual, will determine the credits that are required. If somebody's over the age of 42, it's going to be 5 years or 20 credits within the previous 10 years. So depending upon the age of the individual will determine how many years of work that are needed. As an example, somebody 56 is going to have to, for SSDI, to be eligible for the benefits based on their contributions, have 8.5 years worth of work to be eligible for that program. Now, childhood disabled beneficiary. This is again under the SSDI program. This is where an individual could be eligible if they have a disability that began before age 22 and after the age of 18 and before 22, and they have a parent that is eligible. And an eligible parent is a parent that is either retired, disabled according to Social Security, or has passed away. This is a benefit where the individual is going to receive SSDI based on a parent's contributions. Now, the disability beginning before age 22, there has to be either a decision made by Social Security that you're able to get the records from by requesting them, because they do not adopt a prior decision. Even though they made a decision, they may have made a decision that the individual is disabled and on SSI before. You still have to capture that record. And that's why I tell parents, when you get a decision that's approved, make sure that you hold on to the records so that when you retire, or God forbid you become disabled or die, it's easier to get your child on benefits based on your contributions. If there is disability or retirement of the parent, the child receives a benefit that's equal to half the amount of the parent's benefit. Upon death of the parent, the child receives an amount that's equal to 3/4 of the parent's benefit. For a widower, they're able to receive spouse benefit if greater than the benefit that they would be entitled to. They need to be legally widower, at least age 50, unmarried or remarried after age 60. And that allows that individual to access benefits based on a deceased spouse record. They also need to meet Social Security's definition of disability, because this program is based for people that are disabled. And we've just covered the 3 ways that an individual with a disability can access SSDI benefits. Now, the SSDI program doesn't pay from day one. They do have a full 5-month waiting period. You're eligible in the 6th month, and the payments begin the 7th month forward. So they're always paying 1 month retroactive under the SSDI program. Now, that doesn't mean that if it takes you 5 years to get or 3 years to get on the program, and they grant you an onset, that you won't get your retroactive benefits, but they will still implement the 5-month waiting period. So that briefly covers SSDI. Now let's briefly go into SSI. And the reason it's important that you understand the differences is so that the individual or the parent who's assisting that individual understands what program to apply for. So the SSI program is supplemental security income. There are no contribution requirements. The name tells it all. It's there to supplement. And the supplement is based on need, and eligibility requirements for an individual is who's under age 65 is disability, and they also need to show need. So this is a supplementing program. I like to nickname it payer of last resort. So let's go over some of the rules on what they look at for an individual that is applying for supplemental security income. When it comes to financial eligibility exemptions, they exempt a home if an individual has ownership interest and it serves as his or her primary residence. An automobile since 2005 of any value is disregarded. And liquid assets, that's money you have access, for an individual, and this is a rule from the 60s, is still $2,000 for an individual and $3,000 for a couple. For those of you that are familiar with Medi-Cal, it's a health insurance program, they changed their rules last year in July, but SSI is still individual 2,000, couple up to 3,000. And here's illogic again. When there's a couple, it's not twice the individual, they reduce the actual amount. Additional items that are exempt are items related to the individual's disability. And also household goods of any value. And that's as of March of 2005. Now, note in this world where everybody's on the computer and doing collections, collectibles, believe it or not, are not exempt. Additionally, whole life or other insurance policies with a cash surrender or face value of less than $1,500. Again, it's an old number. All term life insurance policies of any value, a burial plot or other burial space of any value, and up to $1,500 set aside specifically for burial expenses. Now, the benefit in California is a combination of the federal benefit rate of $914 and the state supplemental program, which in California is $219.73, giving us a grand total of $1,133.73. So that's the amount that SSI supplements up to. They're going to reduce the benefit depending upon the living situation of the individual, or if that individual has income. If an individual is visually impaired, blind, it's $1,211. So let's take a look at how the SSI program looks at income when they're determining how they're going to supplement up to that $1,133.73. Well, they're going to look at any unearned income that's coming to the individual, such as SSDI, California SDI, or money from any source that's coming to that individual. It could be mom or dad giving them $1,000 a month to cover their expenses. Now that $1,000 a month is going to reduce the SSI dollar for dollar after the first $20. Unearned income, or excuse me, earned income as far as wages, what Social Security does is they allow that $20 deduction if not already used. They allow a $65 deduction, and then what they do is divide what's left by 2 to determine how much the SSI benefit is going to be reduced by. And then there's in-kind support and maintenance. This is where an individual is not covering their fair share of living where they're getting free rent, where mom and dad or a family member or somebody, it's charging them less than what they would charge someone else. This is often where families, to get the full value, will often do things like open up an ABLE account, and the ABLE account gets funded. The individual uses that ABLE account to cover their portion of their food and shelter, and then the individual gets the full benefit amount. Okay, here we go. So the SSI program, when an individual is on SSI child benefits, let's briefly talk about that. So you may have an individual who qualifies for SSI as an under 18 child, and the household's income and resources are low enough for that child to qualify. When they turn 18, what occurs is Social Security changes the definition of disability. And as a child under the age of 18, sorry, I got ahead of myself, they meet the child's definition of disability. There's in-kind support and maintenance. That's where they look at what's going on with mom or dad or the caregiver of the child as far as their income and resources. That's why a lot of individuals under the age of 18 don't qualify for SSI, and they will do what's called deeming the parent's income, where mom or dad's income is looked at percentages and further reduce the SSI benefit. But if you have a situation where the under age 18 child is qualifying and they're going to transition to an adult benefit, then they need to transition to the definition of disability as an adult. The in-kind support and maintenance that I mentioned before, they're participating in their financial, or excuse me, in their food and shelter come into play. And deeming, looking at mom and dad's income, is no longer considered. Starting the process, so what'll occur is as the individual is turning age 18, if Social Security is on track, they'll go ahead and start what's called a medical continuing disability review. And it's typically a couple of months before the individual's 18th birthday. And you have to provide current past evidence, which by law is 12 months. And often I've had them require it be 6 months or less. And then here's the list of forms for that transition to occur. Now, very important for the SSDI program and SSI program, they have continuing disability reviews. For the SSI program, they're going to look at resources annually. So it's important that the individual continue to maintain at or below $2,000. One house, one car. Now, if there is work activity, Social Security will continue or will do a continuing disability review to look at that work activity and determine how it impacts that individual's continued eligibility for SSI and SSDI, and that's a different training that I'll be doing in the future. I briefly talked about earned income under SSI, where SSDI takes a bit more time. Now, this applies to everyone. Medical continuing disability reviews are done every 1 to 7 years. This is why I let families know it is imperative not only that the medical records support the disability, but that it continue to tell the truth, is the way I call it, of the individual's limitations. Social Security, when it comes to the medical continuing disability reviews, they actually set a diary date. And that diary date is a term of art to determine from when the case is granted, how often they're doing a medical continuing disability review. And it's every 1 to 7 years, depending upon what was determined by Social Security as the diary date. And that's it. I'm open for questions.